Hello, Psych 250 students. Happy St. Patrick's Day. I hope that you're wearing green. If not, you may be pinched. Um, we're transitioning, and this is not live, so I don't want you to think that if you ask me a question, I wasn't listening, I don't know the answer, or my hearing has really gone bad. Could have something to do with the headphones. No, this is a taped version of me. So, of course, I'm going to leave questions about the lecture, about anything, open to any time you want to email me, and I'll respond as quick as I possibly can. I'm on campus right now. I'm in my office, and I want to amend a few things. A couple things is I am going to have you turn in your notes to me. You'll have until Friday at 9 a.m. this Friday, which would be March 20th, to turn in Chapter 6 notes. Email it to me, send it as an attachment. I'll respond to you once I get it, which is your confirmation that you got credit for it. If there's a problem with the notes, then I'll make sure I mention that they weren't long enough or the wrong chapter or something of that nature. I'm also going to amend the exam that we take. I'm in the process of writing the exam, and instead of doing what our traditional is of 40 multiple choice questions and 4 or 5 short answer essays, I'm going to do 10 short answer essays, and they'll be worth 5 points each. So the exams will still be worth 50 points. I'll be sending that exam to you. I'll also be doing the reviews after each chapter. I'll give you chapter 5 review after I'm done lecturing on chapter 6. The lectures themselves are going to be broken up into increments of approximately 15 minutes. So if you hear an alarm go off, that means it's time for me to wrap things up, as I have limitations as to how long I can film on YouTube. So I'm still figuring it out. I know you are too. I hope that you're well and washing your hands and taking good care of yourself. I know these are strange circumstances, and I hope that we're able to rejoin back in the classroom, but this is the best we can do for now. And I'm still having you hold on to your papers until further notice, but that may change as we get more information. Apparently, we can have some contact, so if people need to meet in person, we just have to keep our distance from each other. But for the most part, I think this will do for now until we can regroup. Hopefully get back into the classroom, because I miss being in the psych lab. Of course, I can visit the psych lab anytime I want, but and the tables are all clean, the counters are all clean, the boards are all clean. We had our student workers do that yesterday and today, and so everything looks nice and sparkly, but there's no students, so it's not quite the same. All right, so let us get started. The chapter 7 notes will be due by the time our next class meets, whether it's Monday, Wednesday, or Tuesday, Thursday, at the beginning of class time. We'll just count that as the start time for when things are due. So you can just email those as you get them done, right? As long as you have them due the first day of class, either Monday or Tuesday. All right, so let's get started with this very new way of teaching in my office, of all places, with chapter 6. Chapter 6 is somatic symptoms and dissociative disorders. Somatic symptoms are really relevant as we speak, because we've got a lot of folks coughing and feeling kind of hot, and that could be the flu, it could be the cold, it could be just the stress that folks are under, primarily because of what's going on in our world today. So hopefully you're not too stressed out. I've been going for my walkabouts when it's not pouring. And a lot of places that we would love to go to, South Coast Plaza, Disneyland, places like that are closed. But doesn't mean we can't go out and explore nature. And when I've been on my walkabouts lately, I've noticed a lot of people, a lot of families, a lot of bikers out there riding their bikes and going for a stroll, taking their pets out and so forth. So that's kind of nice. More people than I'm used to seeing. So it's nice that people are out and about. And people are being nice and friendly, waving at each other and things like that. let's start off with our little humor here. And don't worry if you can't read this, I'll read this to you. I can understand my mother and my first grade teacher being there, but there's also a TV announcer who does dog food commercials and a second string catcher for the Detroit Tigers. Yes, Detroit. What's the diagnosis? I think you got it. Dissociative identity disorder, right? Let's start off with somatic symptoms and related disorders, right? So what are we talking about? We're really talking about a real physical illness, right? You actually have somebody who goes into the clinic or to the doctor, and they actually have some of the actual physical phenomena occurring. I myself one time went to the doctor and I had a rash pretty much all over my body, very noticeable rash, right? It wasn't like, you touch something, you get allergic to it. No, this was throughout my whole body. So, of course, the doctor's thinking, well, I must have consumed something and it affected all of my body. I haven't had any rash like that before that or since that time. But one of my brothers had recently died. And in dealing with the grief process, I think my body just reacted to the stress, right? I haven't had that reaction since that time. It doesn't mean I haven't grieved about things, but that's a possibility. I still don't know the ultimate outcome because the tests were inconclusive as to what the physical causality was, but I have a suspicion it might have been just the stress I was under. Pretty normal stuff. Extreme, but normal. We have a variety of different types of disorders that can occur. Everything from conversion disorders, where you actually lose your ability to perhaps your hand, where your leg becomes paralyzed. You might even lose your sight. To factitious disorders, where things are just pretty much bogus, right? They're in our head. And of course, as you noticed, I'm sure you've noticed already, that a lot of our disorders are kind of melding and merging together, right? So it's not unusual. You notice on the last slide there, it mentioned anxiety. Anxiety, depression seem to be a common theme with these other disorders that we've talked about. Why? Because in today's circumstances, since we're not meeting in person, or even if we were meeting in person, there still might be some anxiety related. Gosh, this person's less than 6 feet away from me. That person sneezed over in that side of the room. What does that mean? Well, that could produce a lot of anxiety and depression, especially when we start having these symptoms and the doctors really don't have a real good cause as to what's causing them. So when we look at what is some symptoms of a somatic disorder, we're really talking about something that lasts. It's not an overnight thing. It's lasting at least 6 months. And many of you have had illnesses that have been very persistent. They just don't want to let up. And we're taking the medicine and we're trying to rest and we eat what we can and we exercise what we can, but it just doesn't want to seem to go away. So many times when I was a clinician, I would, of course, ask one of the first questions when people is presented as such is, have you seen your doctor? Have you had a physical lately? Have you ruled out some physicality things? And then I'd focus on what's going on with your life psychologically, either presently or things that you're anticipating or in the past. Again, trying not to separate the mind-body thing. It's all connected. Now, I want to show you this particular gentleman that I used to work with. We're going to call him Jim the Super Therapist. Here's a picture of Jim the Super Therapist. I've put some fake sunglasses on him. This is a picture of him right here, right? This is a picture of your favorite neighborhood Spider-Man back in the day. At that time, I worked at the agency called La Casa. Now, I'm sure you remember that. If you had me for Intro to Psych, La Casa was where which stands for the Latin American Community Against Substance Abuse. It's an outpatient substance abuse clinic, and that's the first job I ever had as a therapist. Now, when I worked for La Casa, I had no idea what I was doing. No idea whatsoever. However, Jim, the super therapist, took me under his wing. He was a former heroin addict, and he knows the ins and outs of drug abuse and the lies that clients would tell when they came into therapy. And so he was my mentor. But unfortunately, one day he arrives to my office and he noticed that his hand is bandaged. His hand was bandaged. It was his right hand. And there I am. I got another pose shot, and there he is, not looking very happy, which actually was quite true at that particular time. Notice the old telephones with the dial rotaries. I mean, we are talking about 1979, right? Goes back a few years. He comes to the office, and he's got his hand bandaged. So what's going on? Well, he went to the doctor. They couldn't find anything wrong with him. And he couldn't write the notes for his case file. So he asked a favor of me. Would I mind listening to the recording of his sessions, with permission from his clients, of course, and write the case notes for him? And of course I said yes. He helped me. That's the very least I could do to help him. Now, unfortunately, what wound up happening after the fact was I found out through the grapevine, and you know the grapevine is very, very, very long, was that Jim the super therapist was using heroin again. This is after I left La Casa and came to college. And I heard that he was fired, and he refused to acknowledge that he was using again, that he had had a relapse. And I was suspicious that this could be the truth because I did receive a phone call before the news broke of him asking me very frantically if I wouldn't mind supplying some urine for a urine test that he was going to do. Now, anybody asks you to supply urine that doesn't belong to them, something's wrong. You don't have to have spidey senses to figure out something's wrong. So unfortunately, he did relapse and he was fired, and I saw him some years later, and he looked very different from the professorial look that he looked at La Casa. He was long-haired, disheveled. He looked like he was homeless. And the only thing I recognized him when I saw him later was his eyes, and I knew that it was Jim the super therapist, and I thought, how sad the mighty have fallen. So what was the disorder here? Well, the disorder, I believe, was conversion disorder, a disorder in which the anxiety of relapsing back into the drug world was so overwhelming that what did it do? Paralyzed his hand that he would use to write notes, thus sabotaging his job. So psychologically, he felt like he was fired only because he couldn't keep up with his notes. And of course, we know this is a complex thing when we talk about addictions, that a denial plays a huge role in acknowledging that one has a problem. And he couldn't come to terms with that. And it's too bad because he was such a super therapist and a mentor to me, but yet he couldn't acknowledge that he had a problem. And how can you be somebody in the helping professions if you yourself are not well, right? So pretty drastic lesson for us to learn, for sure. It can affect us in a variety of ways. It can affect our motor skills, weakness, seizure-like symptoms. In Sigmund Freud's day, it was so severe, people literally would go blind or become paralyzed. And they, of course, could not find out any physical causality. Of course, today we have technology that can rule out a lot of stuff, but almost immediately, and start to focus on the psychological as opposed to just the physiological causality. Okay, so that's going to kind of wrap us up for this particular video. Stay tuned. I will provide more from this exciting chapter. Thank you for your attention.